Now let us see the blood supply of stomach. You know, stomach develops from the foregut, and the artery of foregut is the celiac trunk. So the stomach receives blood from the celiac trunk. Let us draw the diagram. So here is a diagram of stomach. Here is the celiac trunk. Drawing the celiac trunk. The celiac trunk has got mainly three branches. Okay, and the largest branch is the, this is the splenic artery. We have the spleen here. This is a splenic artery. Towards the right side we have common hepatic artery. Okay, and one more branch is known as the left gastric artery. This is the left gastric artery. Okay, then what happened to this common hepatic artery divided into one which is going upwards? So here we have the liver, so this is the proper hepatic artery, and the one which is running downwards is known as the gastroduodenal artery, gastroduodenal. So let us label it. So this is the celiac trunk. Okay, and here we have the splenic artery. Okay, this is the common hepatic artery, common hepatic artery. This is the proper hepatic artery, proper hepatic artery. The one which is going downward is known as the gastroduodenal. From the name itself we can see it supplies both the duodenum and the stomach, gastroduodenal artery. Okay, now what happens with gastroduodenal artery? The gastroduodenal artery divides into two branches. On reaching the along the lesser curvature divides into two branches. One is like this, one is like this, and another one is like this. So this artery is known as a superior pancreatico-duodenal artery, superior pancreatico-duodenal artery. Okay, and this one is known as the right gastroepiploic artery, right gastroepiploic artery. Okay, from the splenic artery there arises a branch along the greater curvature that is known as the left gastroepiploic artery. Okay, and from the common hepatic there arises the right gastric. This is the right gastric artery, and here we have the left gastric artery, Okay, so this splenic artery, the last terminal part gives short gastric branches supplies. These are the short gastric artery. Okay, so these are the blood vessels supplying the artery. So once again I am telling, so we have the left gastric artery, which is a branch of celiac trunk, right gastric artery which is a branch of common hepatic artery, left gastric artery and right gastric artery, anastomosis along the lesser curvature within the lesser omentum, Okay, then we have the splenic artery supplies the stomach. The splenic artery gives along the lesser curvature, it gives short gastric branches, and from the splenic artery rises another branch called left gastroepiploic artery along greater curvature, which anastomoses with the right gastroepiploic artery, which is a branch of the gastroduodenal artery. Gastroduodenal artery in turns is a branch of common hepatic artery, branch of celiac trunk. Okay, so these are the blood vessels supplying the stomach. Then there are corresponding veins are there. So corresponding to the right gastric artery we have the left gastric artery, we have the left gastric vein. Then corresponding to the right gastric artery we have the right gastric vein. Then there we have this short gastric veins are there, left gastroepiploic vein, right gastroepiploic veins are there. Okay, right. So these are the arterial supply and the venous drainage of the stomach. Next is a lymphatic drainage. You have the stomach here, very easy to remember. Okay, see, I'm just going to. So we can divide the stomach into two like this. Okay, and the whole For the descriptive purpose, the stomach is divided into two areas. So here we have the right two-third and left one-third. Right two-third and left one-third. Again the right two-third is again divided into upper two-third and lower one-third. And the left one-third is divided into upper one-third and lower two-third. Okay, once again the whole of the stomach divided into two areas, right two-third and left one-third. Again right two-third is divided into upper two-third and lower one-third. Left one-third is divided into upper one-third and lower two-third. Okay, we can name this category in these regions into, this is the first area, this is the area number 2, this is area number 3, and here we have the area number 4. Okay, and the area number 1, that is the upper two-third of the right two-third, is draining into this area, that is a left gastric node. Okay, area number 2, that is the lower two-third of the left one-third, is draining into right gastroepiploic nodes. Okay, and area 3 drains into pancreatico-splenic nodes, and area 4th, this area, that is the lower one-third of the right two-third, drains into the right gastric node. Right gastric node. Okay, and also to the hepatic nodes, right gastric nodes, and also to the hepatic nodes. Okay, from all these areas, that is all these lymphatics drains finally into celiac nodes. Okay, once again I am telling the for descriptive purpose the stomach is divided into different lymphatic areas. Okay, first of all it divided into right two-third and left one-third. Right two-third is divided into upper two-third and lower one-third. Left one-third is divided into upper one-third and lower two-third. Okay, upper two-third of the right two-third, that is area number 1, drains into left gastric node. Area number 2 is the lower two-third of the left one-third, drains into right gastroepiploic nodes and also to the pyloric nodes. Area 3 is the upper one-third of the left one-third. Upper one-third of left one-third drains into pancreatico-splenic nodes, and area 4 is the lower one-third of the right two-third, drains into right gastric nodes and the hepatic nodes, and from this whole area it drains into the celiac nodes. From the celiac nodes, where these lymphatics goes to the cisterna chylae. You know cisterna chylae? What is cisterna chylae? Cisterna chylae is the proximal starting point of the thoracic duct. That is the lymphatic drainage of stomach. Okay. Now the gastric carcinoma normally occurs in the region of pyloric antrum along the greater curvature. Of the stomach. So the gastric cancer spread by the lymph vessels to the left supraclavicular lymph nodes through the thoracic duct.